I want to ask you something, and I want you to answer it honestly, even if it is just to yourself. When was the last time you ate a piece of chocolate and felt nothing afterward? Not guilt, not anxiety, not that quiet internal negotiation where you tell yourself you will be more careful tomorrow. Just enjoyment. If you are managing pre-diabetes or type 2 diabetes, I suspect that feeling is a distant memory. And I need you to hear this because I am going to spend the next 20 minutes showing you something that will genuinely change how you think about this disease, about this food, and about the advice you were given when you were diagnosed. The belief that chocolate is your enemy is not just outdated. In some cases, it has cost people with diabetes a legitimate therapeutic tool they could have been using all along. There is a form of chocolate sitting on your grocery store shelf right now with a glycemic index of just 22. For context, white bread sits at 71. Table sugar sits at 65. This chocolate, which I am going to show you how to identify in under 30 seconds, contains compounds documented in peer-reviewed clinical research to improve insulin sensitivity, reduce the inflammatory markers that keep diabetes progressing year after year, and support the regeneration of the cells in your pancreas that actually produce insulin. The compound responsible for all of this is not exotic, it is not expensive, and the difference between the chocolate that harms you and the chocolate that helps you is printed on the back of every single package in your supermarket, waiting for you to look. Today, I am going to walk you through 5 specific types of chocolate that the clinical evidence supports for people managing blood sugar, ranked from the most accessible entry point all the way to the option with the strongest and most impressive research behind it. Pay close attention to the last one. It is the least expensive thing on the shelf, and it carries the most compelling clinical data of all 5. Before I give you a single name, I need to give you the foundational understanding that almost every article about chocolate and diabetes skips entirely, because without it, these 5 types will feel like an arbitrary list. Once you have it, every single one will make complete biochemical sense, and you will never look at a chocolate label the same way again. The benefit does not live in chocolate, it lives in cacao. And those 2 words do not mean the same thing. A mass-produced milk chocolate bar loaded with refined sugar, hydrogenated vegetable oil, and synthetic flavoring has almost nothing meaningful in common with the raw cacao bean it technically descended from. It borrowed the name and left most of the medicine behind. The healing is in the cacao. The industrial bar is a different product wearing the same clothes. Cacao contains a dense concentration of plant compounds called flavonoids. The 2 that matter most for your blood sugar are catechin and epicatechin, and together they work on the biology of diabetes through 3 distinct mechanisms that I want you to understand clearly. The first is improving insulin sensitivity by repairing the endothelium, the delicate lining of your blood vessels. Insulin resistance can be thought of like a signal that is being drowned out by noise. Insulin is sending the message. Glucose is waiting at your cells, ready to move inside, but the cell membrane is no longer receiving the signal cleanly. Cacao flavonoids work on the endothelium to restore that signal. They reduce the interference so your cells can hear what your insulin is already trying to tell them. The second mechanism is reducing oxidative stress. Cacao consistently ranks among the highest scoring foods ever measured for antioxidant capacity. And oxidative stress is not an abstract concept. It is one of the primary reasons insulin receptors lose their responsiveness. When you reduce oxidative stress at the cellular level, those receptors begin working again. The message gets through. The third mechanism is the one that genuinely changed how I counsel patients in my clinic. Epicatechin, the most abundant flavonoid in cacao, has been shown in cellular studies to stimulate insulin secretion and to support the regeneration of the beta cells in the pancreas. The beta cells are the ones responsible for producing insulin. In type 2 diabetes, they are slowly worn down and destroyed over years. The idea that a food compound could support the restoration of those cells rather than simply compensating for their loss, is a fundamentally different kind of conversation. It is not just managing the disease, it is addressing its biological foundation. So when I rank these 5 types of chocolate, I am not expressing personal preference. I am ranking them by how much of this flavonoid content they actually deliver and how strong the clinical evidence is that sits behind each one. Let us begin. The first type is dark chocolate with at least 70% cacao. I place this first not because it is the most clinically powerful of the 5, but because it is the most realistic and sustainable place for most people to begin. It is available in every mainstream grocery store. The taste is firm, slightly bitter, and still genuinely enjoyable. And the science behind it is solid enough that I have recommended it to patients without hesitation for years. Here are the numbers that matter. 70% dark chocolate has a glycemic index of around 22. Table sugar, for comparison, has a glycemic index of 65. White bread sits at 71. A square of good quality dark chocolate produces a slow and gentle rise in blood glucose, not the sharp, sudden spike that most people with diabetes have been warned to fear from anything in the chocolate aisle. The reason is straightforward. At 70% cacao, the sugar content is substantially lower than in milk chocolate. And what sugar remains is slowed by 2 things: the natural fat from the cacao bean, which reduces how quickly sugar enters the small intestine, and the cacao fiber, which delays how quickly the stomach empties. The body simply never sees a flood, it sees a trickle. I want to tell you about a patient I will call Margaret. She was 64 years old when she came to see me with a fresh pre-diabetes diagnosis and an A1C of 6.1. She was living alone and had been eating 3 or 4 small pieces of milk chocolate every evening after dinner for years. She called it her reward for a long day, and she felt guilty about every single piece. She told me she had started hiding the chocolate in a kitchen drawer so she would not have to look at it. I did not tell her to stop. I told her to switch. 2 squares of 70% dark chocolate after a dinner that included protein and fiber. 3 months later, her A1C had dropped to 5.7. But the thing she told me in that follow-up appointment that I remember most clearly was not the number. She said she had taken the chocolate out of the drawer. A clinically supported portion is around 20 to 30 grams per day, which is 2 or 3 small squares. And there is one label trap I need to make sure you know about before you buy anything. Many bars sold as dark chocolate, even those labeled 70% cacao on the front, list sugar as the very first ingredient on the back. The front of any package is marketing. The ingredient list is the truth. Flip the bar over. The first word on that list must be cacao mass, cacao paste, or cocoa mass. If sugar appears first, the bar is not what the front label claims, regardless of how dark it looks or what percentage is printed on the wrapper. The second type is dark chocolate with 85% cacao or higher. And I want to be precise here, because this is not simply a more intense version of the first type. At 85%, the clinical conversation changes in a specific and important way. As the cacao percentage rises, 2 things happen simultaneously. The flavonoid concentration increases substantially, and the sugar content falls from around 20 to 25 grams per 100 grams down to roughly 10 to 14. More of the therapeutic compound, less of the metabolic problem, in the same bite. I want you to know about a specific study. A clinical trial examined chocolate with 83% cacao in 60 patients with both type 2 diabetes and high blood pressure. Each participant consumed 25 grams per day, containing 450 milligrams of flavonoids for 8 weeks. The results were significant. Lipid profiles improved, and 3 inflammatory markers that sit at the center of the diabetes picture, C-reactive protein, interleukin-6, and TNF-alpha dropped meaningfully across the group. I need you to understand what those 3 markers actually represent. They are not just numbers on a laboratory report. They are the primary molecular drivers of the chronic, low-grade inflammation that keeps insulin resistance burning forward year after year. Chronic inflammation is not a side effect of diabetes. For many patients, it is the engine. When you reduce CRP, when you lower interleukin-6, you are not chasing a symptom. You are turning down the heat on the fire itself. There is another dimension to 85% chocolate that matters particularly for anyone over 60 managing blood sugar. 2 large Swedish studies found that increasing dark chocolate consumption to at least 50 grams per week reduced stroke risk, both ischemic and hemorrhagic, by up to 27%. For someone whose diabetes has already elevated their cardiovascular and cerebrovascular risk above baseline, that is not a small footnote buried in the research. That is direct, documented protection for your brain. A practical portion at this percentage is 20 to 25 grams per day. And one of the quieter advantages of moving to 85% is something I have observed consistently in my patients. The flavor is so much more intense and so much less sweet that you naturally stop after 1 or 2 squares. The bar asks you to slow down. Your taste buds are satisfied before the temptation to keep going fully registers. For people who have spent decades struggling to moderate their intake of sweeter chocolate, that natural pause is not a minor detail. It is the difference between a sustainable habit and an ongoing battle. The 3rd type moves us to the outer boundary of the chocolate world. 100% cacao and cacao nibs. No added sugar, no milk, no fat beyond what already lives inside the bean itself. Cacao in its truest, most unprocessed form. Cacao nibs deserve particular attention here. These are pieces of roasted cacao bean that have been crushed, but not refined or processed further. Because they skip the pressing and conching that other chocolate goes through in manufacturing, they retain more of their original flavonoid content and more of their original fiber than any bar. They are crunchy and deeply bitter, and they look almost nothing like the chocolate most people grew up eating. I want to be completely honest with you the way I would be sitting across from you in my office. Most people cannot eat 100% chocolate as a standalone treat and enjoy it. After 60 or 70 years of living with sweetness as a flavor reference point, the bitterness of fully unsweetened cacao is simply too sharp a contrast. And I have no interest in recommending something I would not realistically expect you to use. So I do not suggest eating it alone. I suggest using it as an ingredient. That is where it becomes both powerful and genuinely enjoyable. A teaspoon of cacao nibs scattered across plain Greek yogurt, 10 grams of 100% chocolate melted into a spoonful of almond butter, a small handful of nibs folded into morning oatmeal. These are simple, practical additions that deliver real flavonoid content into your day with essentially no impact on your blood glucose curve because there is no sugar present to impact it. I had a patient I will call Robert. He was 71 years old, 12 years into his type 2 diabetes diagnosis, with an A1C that had been sitting at 7.3 on metformin for the better part of 3 years. He had loved chocolate his entire adult life and had given it up completely 5 years earlier. He told me his numbers had never once improved in those 5 years of abstinence, which he mentioned with a quiet frustration I found completely understandable. We talked about cacao nibs. He started adding a teaspoon to his breakfast oatmeal each morning. 4 months later, he looked at me across the desk and said something I still think about. He said, "I cannot believe something this good is actually helping me." His A1C had moved to 6.8. The 4th type is sugar-free chocolate, but specifically and only the kind sweetened with erythritol or stevia. And I want to be very direct in this section, because this is the category where the food industry is most actively misleading the people who most need to be guided honestly. Erythritol is a sugar alcohol with a glycemic index of essentially 0. It delivers about 70% of the sweetness of regular sugar, but your body processes it through an entirely separate pathway and excretes the vast majority of it through the kidneys without meaningfully raising blood glucose or triggering an insulin response. Stevia takes a different route to the same destination. The steviol glycosides that give it its sweetness are not metabolized by the body at all. They pass through without producing any measurable glucose effect. A chocolate bar sweetened with erythritol or stevia can offer a flavor experience surprisingly close to the milk chocolate you remember, with almost none of the metabolic cost. But this is where you must be careful, because many bars marketed aggressively as sugar-free or diabetic-friendly do not contain erythritol or stevia. They contain maltitol. Maltitol has a glycemic index of 52. That is not a low number. That is a number fully capable of raising your blood sugar, particularly if you eat more than 1 or 2 squares. And beyond the glucose issue, maltitol in older digestive systems frequently causes bloating, abdominal discomfort, and in some cases, sudden urgent diarrhea because of the way it draws water into the large intestine. I have had patients call me in genuine distress after eating a diabetic-labeled chocolate bar that contained maltitol, describing effects they found both uncomfortable and embarrassing. The bar said diabetic-friendly on the front in large, confident letters. Here is your 30-second rule for this entire category. Pick up the bar, turn it over, find the sweetener in the ingredient list. You want to see erythritol or steviol glycosides written clearly. If you see maltitol, isomalt, or a vague reference to sugar alcohols without specifying which one, return the bar to the shelf. The front of the package cannot be trusted in this category more than in almost any other. Trust the ingredient list. Only the ingredient list. And now, the 5th type, the one I asked you to pay attention to at the beginning of this video. The cheapest option, the one with the most clinical evidence, the one that most people walk past every week without giving it a second thought. Pure, unsweetened cacao powder. A large container costs roughly the same as a single premium chocolate bar. It contains no added sugar, no added fat, no additives of any kind when you buy it in its natural form. And it is the form of cacao that, when you look at the clinical research carefully, consistently outperforms every other form on this list in terms of documented impact on blood glucose and A1C. I want to walk you through the study that changed how I approach this conversation with every patient I see managing type 2 diabetes. A systematic review published in 2021 analyzed 7 clinical trials examining the effects of cacao flavonoids on blood glucose and serum insulin in people living with type 2 diabetes. The consolidated finding was this: dark chocolate or cacao powder consumed at a dose of 25 to 30 grams per day showed beneficial effects on blood glucose and on hemoglobin A1C, along with cardiovascular protection through improved HDL cholesterol. I need you to understand the weight of that A1C finding. A1C is not a snapshot of how your blood sugar looked on one particular morning. It is a 3-month average, a reflection of how your body has been handling glucose consistently across an entire season of your life. When a dietary intervention moves that number in a controlled trial, you are not looking at a transient effect. You are looking at a durable, structural change in how the body is managing glucose over time. That is a different category of evidence from most food-based interventions. So why does plain cacao powder outperform even a high-quality dark chocolate bar? Because making a chocolate bar, even an 85% one, requires a manufacturing process that includes pressing, conching, and tempering. Each of those steps degrades a portion of the flavonoid content. The finished bar is better than milk chocolate in every respect that matters. but it is a processed version of what the cacao bean originally contained. Pure, natural cacao powder, specifically the kind that has not been alkalized or Dutch processed, preserves far more of the original flavonoid content because it bypasses most of that degradation. If a chocolate bar is brewed tea, cacao powder is the whole tea leaf. The active compounds are more intact, more concentrated, and more available to your body. In daily practice, this is also the easiest of the 5 to integrate without disrupting your existing routine. A tablespoon stirred into black coffee in the morning. A teaspoon blended into plain, full-fat yogurt at breakfast. A small amount warmed gently with unsweetened almond milk on the stove in the evening. A spoonful folded into oatmeal. Every one of those choices delivers more flavonoid activity than a square of dark chocolate, with no meaningful glycemic impact whatsoever. I want to tell you about a patient I will call Carolyn. She was 68 years old and had been living with type 2 diabetes for 5 years. Her A1C had been stubbornly parked at exactly 7.0 for 2 consecutive years. She was taking her medication faithfully. She was walking every single day. She told me, with a frustration that was palpable across the desk, that she felt like she was doing everything right and her numbers refused to move. We changed exactly one thing. The sugar and the flavored creamer she had been adding to her morning coffee were replaced with 1 tablespoon of pure, unsweetened cacao powder, a few drops of liquid stevia, and unsweetened almond milk. That was the only change we made. 6 months later, her A1C was 6.5. Half a point in 6 months from a single daily cup of coffee. Not magic, biochemistry. Working quietly every morning in a mug she already had. The label trap for this category is the simplest one on the entire list. The ingredient list on your cacao powder should contain exactly one item: cocoa powder or cacao powder. Nothing else. Not a blend, not a mix, not a flavored variety. Avoid every product labeled hot chocolate mix, drinking chocolate, or reduced sugar cocoa blend, regardless of what the front claims. Even the ones with wellness-oriented labels will frequently contain modified starch, added sweeteners, or hydrogenated oil that dismantles the entire therapeutic profile you now understand. Before I bring everything together, I want to address something that almost never comes up in clinical conversations about food and diabetes, even though it sits underneath nearly every patient's experience of trying to manage this disease through diet. Something I have watched undermine genuinely good intentions in patients for more than 2 decades. Have you ever removed a food completely from your life, told yourself it was gone forever, held to that for weeks or months, and then one evening found yourself eating twice as much of it as you ever would have eaten before, followed by a period of guilt and quiet self-punishment that set the whole cycle in motion again? If that experience is familiar, I need you to understand that you are not weak. You are not lacking discipline. You are responding exactly the way the research in nutritional psychology predicts a human being will respond to complete food restriction paired with guilt. Studies have shown something that surprised me when I first encountered it in the literature. People who feel guilty after eating tend to eat more in the hours that follow, not less. The guilt itself, the cortisol it raises, the psychological restriction it reinforces, triggers a cycle of craving and rebound that produces measurably worse blood sugar control over time than a calm, informed, portion-controlled inclusion of the food. Restriction plus guilt is not a sustainable metabolic strategy. It never was. Let me paint you a picture of 2 patients sitting in my waiting room. They are going to eat the exact same 2 squares of 85% dark chocolate after dinner tonight. The first patient knows that the glycemic index is 22. She understands that the epicatechin she is about to consume is quietly working on her insulin sensitivity. She eats those 2 squares deliberately, enjoys them fully, and moves on with her evening without a second thought. The second patient believes with every bite that she is doing damage to herself. Her cortisol rises. Her guilt rises. By 10 o'clock, she has eaten 3 more squares she never planned to touch and is lying awake rehearsing what she should have done differently. Same chocolate, same body, completely different outcomes. Because the knowledge changed the experience, and the experience changed the behavior. Sustainable diabetes management across years and decades does not look like perfect restriction. It does not look like iron willpower grinding against desire every single evening. It looks like knowing what you are eating, why it is safe, exactly how much is appropriate, and then actually enjoying it without the cortisol storm that guilt produces. Plan the inclusion, control the portion, choose the right type. Those 3 things, repeated quietly over time, outperform a lifetime of guilt every single time. Let me bring everything we have covered back to where it can actually help you starting tonight. Chocolate is not forbidden to you because you have diabetes or prediabetes. The wrong chocolate is. And the difference between the wrong kind and the right kind is printed in plain text on the back of every package, waiting for 30 seconds of your attention. You now know the 5 forms the evidence actually supports. Dark chocolate at 70% cacao is your most accessible entry point, with a glycemic index of just 22 and real research behind it, as long as cacao mass is the first word in the ingredient list, not sugar. Dark chocolate at 85% is where the clinical data shifts to directly reducing the inflammatory markers that keep the disease progressing, with the added benefit of naturally supporting moderation because of its intensity. 100% cacao and cacao nibs represent the zero sugar tier, most effective when used as an ingredient folded into foods you already eat, delivering maximum flavonoid content with no glycemic impact. Sugar-free chocolate sweetened with erythritol or stevia gives you the closest experience to the milk chocolate you remember, but only when you flip the bar over and confirm that maltitol is nowhere in the ingredient list. And pure, unsweetened cacao powder is the most affordable, most concentrated, and most clinically supported form of all 5, with documented effects on A1C that put it in a different category from the others. Here is what I want you to do before this week is out. Open the pantry or the cabinet where you keep anything chocolate related. Take out every product. Flip each one over and read the first word in the ingredient list. If that first word is sugar, set it aside. If it reads cacao mass or cocoa mass, it can stay. Then on your next grocery run, pick up 1 container of pure, unsweetened cacao powder. Read the ingredient list before you put it in your basket. It should say 1 thing. Start with 1 tablespoon in your morning coffee or your oatmeal. For the first few days, check your blood sugar 2 hours after breakfast and watch what happens. Your own body's response is the most honest data point available to you. And at your next medical appointment, consider asking your physician 1 simple question. Given where my A1C is right now, is there a place for cacao powder in my daily nutrition plan? That is a conversation worth having, and going into it with the knowledge you have now will make it a much more specific and productive one than most food-related conversations that happen in a 15-minute appointment. Tell me in the comments which of these 5 surprised you the most, and tell me which one you are going to try first. I read every comment, and your answers genuinely shape what I cover next on this channel. If you know someone who has been carrying chocolate guilt for years alongside their diabetes diagnosis, please send them this video. 1 small change in their morning cup could be the thing that finally moves a number their doctor has been watching for 2 years. Thank you for spending this time with me. I will see you next week.